Good afternoon, students. My name is Hakeem Khatib. I'm a physical therapist graduating from Georgia Southern University. I am also certified NASM, National Association Sports Medicine, personal trainer, and certified strength and conditioning specialist. I currently work at Atrium Health Floyd as the head athletic therapist on staff. I have worked with many athletes, both professional, college, and high school level. I have also been part of Emory Orthopedics Sports Medicine for the Atlanta Hawks. The reason I'm speaking with you all today is because I used to be an athlete just like you, and I played basketball in high school and for a few years in college. Then one day during a game, I got injured and tore my Achilles tendon right off the bone. This took me out of the game that I loved. This is the reason I'm here speaking with you all today. I want to teach you all today about how to prevent sports injuries, and if an injury does occur, the tips and tricks I use on my patients every day for a faster recovery, time, and better results, so you can come back better than ever than you were prior to the injury. The key points that you will take away from this lecture is to understand what happens to muscles during exercise, how they are activated and move, and how your body reacts when an injury does occur, as well as techniques and treatments that you will take part in for a faster and stronger recovery and prevent against re-injury. So here is my credentials, and let's get started with this presentation of muscle recovery. Okay, there it is. Okay, the goals of this lecture today is you will learn at least one technique to utilize and start implementing daily prior to exercise to prevent injury. You will learn at least one treatment option you can utilize at home to speed up the recovery process. The objectives. At the end of the lesson, at least 50% of the students will be able to demonstrate at least 3 new stretches they can implement prior to training in their respective sport. By the end of the lesson, at least 75% of the students will increase their knowledge in muscle recovery by learning the rest eyes compression and elevate the RICE technique by the end of the lecture. Okay, starting off, what is a muscle? Muscles are pieces of soft tissue throughout your body. The function of your muscles is everything from sitting, standing, running, weightlifting, and everything in between. Muscles also supports your organs, like your heart is a major muscle that beats thousands of times a day. Made up of 6 parts: myofibrils, proteins, connective tissue, blood vessels, and nerves, mitochondria, ATP, and cytoplasm. As you can see on the image there, everything is labeled and highlighted, so you can differentiate which part is which. There are so many layers to muscle, starting with epinesium, which is a tough connective tissue which surrounds a bundle of nerve cells called fascicles. The fascicles are surrounded by the perineum, following blood to flow to the individual fibers. Each fiber is wrapped in the endothelium to protect layer. The protective layer allows different muscle fibers to slide past one another as they contract. Then the epinesium connects the muscle to tendons, which attach to the perisodium that surrounds bones, thus allowing your body to move voluntarily and involuntarily. Made of thousands of small fibers woven together, muscles are about 75% water, 20% protein, and 5% minerals like glycogen. Muscles contract and relax as we move different parts of our body. The tension from our muscles is the amount of strength we have in the muscle to lift heavy things. Okay, simple enough. So that's a little bit about what muscles are and what they do. Okay, starting with muscle function. There are different types of muscles. There are skeletal, cardiac, and smooth muscles. Starting with skeletal, these muscles are attached to bone and allows movement to control movement. It is considered a voluntary muscle. So some examples of a skeletal muscle be your arms, legs, um, hamstring, biceps, triceps, all that you can move. Uh, the next example is cardiac muscle, only found in your heart. It is an involuntary muscle. It moves on its own. The muscle contracts at a rhythm to pump blood throughout the body. So this muscle works all on its own. Imagine if you had to control your heart pumping blood every single second, you probably wouldn't be able to do anything else. But that's an example of cardiac muscle. It's only found in the heart. Moving on to smooth muscle, found in the walls of internal organs. This muscle helps move substance throughout the body, like food, and it's also involuntary. So examples is your large and small intestines, your stomach. How muscle works is when the muscle receives a signal from the brain and the nerves to the motor end plate that receives the signal. The chemical signal is released called acetylcholine, tells the muscle to contract and begin the movement. After receiving stimulation, they contract and shorten as you begin to exercise. Think about bicep curls. So every time you move your arm up, your bicep enlarges, and every time you move your hand down, it relaxes. After receiving stimulation, they contract and shorten as you begin exercise. Muscles are also elastic, like a rubber band, can return to its original position after being extended or contracted during stretching exercises. Muscles is also acceptable to be changed in response to how it is used. Okay, let's see, next slide. Common muscle-related injuries. There are muscle strains, aka also known as pulled muscle. It is when the muscle fibers are overstretched or torn. Symptoms include swelling, bruising, weakness, and limited range of motion. There's a muscle tear, is when a muscle partially or completely tears from the bone. This occurs when the muscle is overstressed and flexed, detaching itself from the ligaments. This picture is a great example. I don't know if you guys watch professional wrestling on TV, but this is one of the wrestlers, Cody Rhodes. He tore his chest here from a bench pressing incident, and it caused all of this inflammation, bruising, and surprisingly still competed the next night. So props to him. But continuing on, there's a muscle contusion, also known as bruising, is when there is an impact to the muscle causing bleeding and bruising, common in contact sports like boxing or like this person right here. Muscle cramps and spasm, when the muscle involuntarily contracts, usually occurs through dehydration or fatigue. Muscle soreness can be delayed 24 to 72 hours after exercise, or it can be felt right away. The cause is microscopic muscle tear and inflammation after intense and unfamiliar exercise. So you might not feel it right away, but like the saying goes, I'm going to feel this in the morning. Is usually you're going to feel pain afterwards.
Tendinitis is the inflammation or irrigation of the tendon or sheath. This is caused by a series of small stresses. They repeatedly aggravate the tendon, usually indicated by swelling of the tendon. This is a good example right here. Then bursitis from bursae, which is a small jelly-like sac that is located throughout the body in different joints, common in the elbow, usually shoulder. They contain a small amount of fluid that swells. Then the bursa is inflamed, which is what's going on to this patient right here. He has a bursa right on his elbow. It's just a fluid-like sac. Then there's some muscle strains. You got a grade 1, grade 2, and grade 3. Okay, moving on. Regeneration or self-healing. After intense exercise, the muscle can repair itself after intense exercise or minor injury without human prevention like surgery or medication. There are ways the body just heals on its own. The first phase is destruction, injury, and inflammation. When a muscle is strained, the muscle fibers rupture and blood vessels break, leading to swelling and inflammation. Next step, the body reacts to the injury muscle and sends out white blood cells in macrophages to clear debris and damaged tissue. Repair phase, cell activation and regeneration. The satellite cells near the damaged site are activated and become new muscle fibers. The next step is remodeling and mixture phase. The new muscle fibers migrate and integrate into new existing muscle tissue. Body supply improves, bringing oxygen, nutrients for recovery, and scar tissue is broken down to restore flexibility and strength. Factors that influence the self-healing process is nutrition, rest, and recovery exercise. The body does have a way of healing itself, but after a few days and you have not seen improvement, please seek medical attention. Okay, treatment types. There are a few types of treatment options we could do in a physical therapy setting, or you could do on your own. Starting with ice bath / cold plunge, which reduces muscle soreness. Exposing your body to the cold water will constrict blood vessels and reduce inflammation. Decreased inflammation slows down metabolic process, reducing swelling and tissue breakdown. Ice baths should be around 50 to 59 degrees Fahrenheit, and the duration is about 10 to 15 minutes. This is how long you can stay in the bath. Better option for recovery, best to do right after training. Easy to set up, usually just cold water and ice. You'll be fine. And the cold plunge is a little bit different, it's usually a lot colder, from 39 to 50 degrees Fahrenheit. The duration is about 2 to 5 minutes. It encourages mental toughness, immune system benefits, and increased metabolism. Getting started, only do about 1 to 2 minutes. Control your breathing and warm up gradually. So when you get out of the ice bath, don't like right away take like a hot shower or go to a sauna or anything like that. Try to warm yourself on your own. Get like a towel, dry yourself up, all that good stuff. This will help decrease delayed onset muscle soreness after intense workout and prevent pain the following day. Ice bath and cold plunge, also known as cold water immersion, are similar recovery techniques but share differences. Do not stay in the water for too long or risk hyperthermia. And if your goal is muscle growth, then do this once or twice a week, because it is known it can blunt muscle growth. It should only be done once or twice a week. You guys that want bigger muscles, so your weightlifters, or just if you just want your muscle to show a little bit more, it's not highly encouraged to do this all the time. Moving on to compression, improves blood circulation, speeds up the delivery of oxygen and nutrients to fatigued muscle, and removes metabolic byproducts like the lactic acid. Reduce inflammation and swelling. The pressure will reduce the buildup of fluid in the tissue, minimize inflammatory response by controlling blood flow. The compression boots push your blood back to the heart to speed up blood flow. In physical therapy clinic, we usually follow up compression with either heat for prior exercise, beginning of the treatment to help loosen up those muscles, or an ice pack after the treatment to help with any inflammatory and swelling. Okay. We also use a couple other treatment options, starting with cupping. This treatment type is the use of suction cups being placed on your skin, and the pump is used to suck up all the air to create a tight suction effect. The treatment usually lasts 15 to 20 minutes. Benefits include enhanced blood flow. The suction draws the blood to the target area, delivering oxygen and nutrients into the injured muscle. Reduce muscle tensions. The negative pressure can help release tight muscles and alleviate knots and adhesions to the muscle. Faster recovery, decreasing inflammation by speeding up the muscle recovery process, enhancing blood supply to the injured area, reduces stress levels, allowing the muscle to relax. Cupping can be placed in multiple areas, not just the back like you see in this picture, but like on your hamstring, quad, or shoulder. Cupping will boost circulation and speed up the healing process. And to explain, knots are also known as myofascial triggers, which are tight, tense lumps in the muscle that are painful to touch. The muscle fibers are in a constant state of contraction. So the muscle has a hard time relaxing. It's always on. And adhesions are fibrous tissue bands that form after the injury, surgery, or overuse of that muscle. It is when tissues fuse together when they are not supposed to. This can lead to restricted movement and discomfort. And cupping also helps relieve that too. Moving on to dry needling, the procedure of inserting thin needles into trigger points to reduce muscle pain and tension, and can be used with electrical stimulation to activate the muscle and cause it to contract. That's what you see. There's a black and there's a red clip there that clips onto the needle, and that just gives like electrical impulses. Okay. Benefits include improved blood circulation, pain reduction, improved range of motion, and muscle relaxation. Restoring flexibility by loosening the muscle, creating less tension. Reduce muscle spasms by the release of hyper-irritable spots with muscles, allowing muscles to relax. Okay, with the RICE technique, rest, ice, compression, and elevate. Rest, allow your body to relax and avoid using the injured muscle. Refrain from complete immobilization to prevent stiffness and accumulation of scar tissue. Try to do small movements for lower body injuries, like your legs. Don't try to put any weight on it. Don't try to stand up, walk on it, but try to move your leg up and down, side to side. Simple, small movements just to keep the blood flowing. Ice, relieve inflammation and pain by applying an ice pack to the injured area. You could use anything. If you don't have an ice pack at home, you could use anything from the freezer, like vegetables, like frozen peas, corn, anything like that, or crushed ice works really well. Put it in a Ziploc bag, have a little thing to wrap it with so it's not directly on your skin. Compression reduces swelling. With compression, you could use like a sheet, or you could use medical wrap wrapping tape or anything like that, just to put some to compress that muscle a little bit. And lastly, elevate. Raise the injured body part above your heart to decrease fluid buildup. Lay flat on a bed or couch and use a pillow or wedge to elevate your leg. If pain and symptoms continue after 3 days, please see your doctor or physical therapist. Okay, here's a few things you could do to try to recover at home for a faster recovery. One thing you should be doing daily is stretching. Stretching increases flexibility and should be done daily, even after you recover from your injury. I can't stress this enough how many patients come back to me just because once they recovered, they quit doing their exercises and stretching that I have provided for them. So it's very important to start doing that. Massage guns are starting to be affordable and can be bought in most stores. Massage guns can be used before or after your workout or even during your workout and focuses on tension on the sore area and relieve tension on your muscles. Moving on to foam rollers, which is also widely available. They're easy tool to use to alleviate tightness and relieve pain and swelling. It breaks up the knots and adhesions and improve blood flow. Let's see, next up, medicine ball. The medicine ball are great for low impact exercises, relieve stress on your back versus laying on the floor. Great for core exercises like Russian twists, like you see this young lady doing right here in the picture, and crunches. This allows for a deeper stretch and better alignment, encouraging for better posture and balance. Medicine balls improves balance, coordination, flexibility, and improves posture. Okay. There are multiple different equipment that we use in a physical therapy setting. Just to name a few, there are the resistant bands, like you see on this picture, right on your right. There are different levels of resistant bands, starting from looks like 10 pounds going up to 60 and 70 pounds of resistance. The resistant bands give you more of a challenge, and there are different levels. You can do different types of exercises and stretches with them. Very useful. Going on down, parallel bars / stairs. Not all physical therapy clinics have parallel bars like this with a built-in staircase, but I thought this one was pretty cool. Assisted mobility by limiting the amount of weight you put on your legs, and these stairs allows for control going up and down without the risk of falling. We use this all the time to determine if a patient is fit for returning home after surgery or even after surgery, just to make sure they're better fit to be on their own. Ultrasound therapy is also another equipment that we use all the time. It's not used for images like usual ultrasound machines, but it involves high frequency sound waves to penetrate tissue and stimulate cellular activity and increase blood flow and encourages the production of collagen. Okay. Starting with stretches to do prior to exercise. This image kind of gives you a couple different types of exercise you could do. Walking toe touch, lunge with a twist, hip raise, standing leg raise, plank with a twist, and side stretch. There's a couple more that I provided that I personally like. Starting with the hamstring stretch. You stand with your feet hip width apart. You take a step forward with your right leg and gently bend your left leg and touch down towards your right foot. During the stretch, targets the hamstring, improves flexibility in legs, and prepare the lower body for squats, lunges, or running. Then there's an inchworm. Stand with your feet hip width apart and bend forward at the waist, placing your hands on the floor. Walk your hands forward until you are in a plank position. Hold for a second and walk with your feet towards your hands and stand back up. It is a stretch for the hamstrings and activates the core, shoulders, and chest muscles, making it an excellent full body warm up. Also helps with back pain. If you're anything like me and always have lower back pain, inchworms are also a great tool to relieve some of that too. The benefits of stretching and warm-up exercises. The benefits of stretching and utilizing warm-up exercises increases flexibility and range of motion, as well as boosts blood circulation, lower the risk of injuries, reduces muscle tension and pain, and improves workout performance. Stretching prior to exercise will increase flexibility and aid having less tension on your muscles during an exercise, preventing injuries like a muscle tear. Starting on a warm-up prior to your workout or sport practice is essential to elevate your heart rate and warm up your body to move for intense exercises. So the image here increases your body temperature, promotes blood flow to the muscles, and makes the muscles and joints more workable. Warm-up exercises prior to intense workout. There are high knees. During this exercise, raise your knee up towards your chest and back down. This is a explosive movement. The benefits: it warms up your hip flexors and quads and lower body muscles and prepares your body for more intense movements. Jumping jacks. During this exercise, you're hopping in place, moving your legs in and out as well as your arms. This is a full body warm-up exercise that works on your lower and upper body. Mountain climbers. You start on a plank position with your hands under your shoulders and your body straight and quickly bring one knee towards your chest and alternate with another leg. This exercise activates the core, shoulders, and legs and enhances overall endurance. These exercises will increase mobility and flexibility, reducing the risk of injury, and encourages better performance. There are so many other options depending on what your muscle you're focusing on and during your training. Like if you're a runner, you might want to start with a walk, then gradually start to a jog, and once you're warmed up, you can increase your speed to a run instead of running right off the back. List of healthcare professionals consult when an injury does occur. Physical therapists like myself. Physical therapist is more of an ideal medical professional as far as muscle recovery. A PT will give you a sense of direction and treatment plan for a faster and more efficient recovery. Your doctor is going to be your main healthcare provider and will give a diagnosis and referral to a physical therapist that have specialized providers and will take care of all your needs. Personal trainer is recommended after recovery to minimize injury and continue safe and effective workout routines. An orthopedist focuses on musculoskeletal system, which involves bones, joints, muscles, ligaments, and tendons. Orthopedist is going to be the person you will see if you need surgery. All these medical professionals are vital to muscle recovery process and are essential to preventing future injuries. By following up and continue treatment plan even after recovery, this will build up good habits and prevent re-injury. Supplements and foods to aid in muscle soreness and relief. A healthy diet is vital for muscle recovery, which includes everything from what you drink to what you eat, how much you eat. Protein ingredients like nuts, chicken, eggs, and spinach, and so on will aid in recovery of muscle tissue to give the body enough protein to better repair the damaged cells. Fish, which contains omega-3 fats, will help fight inflammation and boost muscle growth. Water is also very important. You have to stay hydrated throughout the day, not just during the workout, and aid in some electrolytes that is lost in sweat. Coffee is also a good option prior to workout. Studies have shown 1 cup of coffee will lower levels of muscle soreness and blocking receptors of adenosine, which is a chemical that is released after you are injured. Sleep also impacts muscle recovery and benefits of resting. Sleep is important for muscle recovery and overall health. Getting enough sleep is vital for your mental and physical health. REM, also known as rapid eye movement sleep, is significant for brain activity like memory, creativity, and retaining information. This type of sleep is when you have the most vivid dreams. Non-REM is what we're going to focus on, is sleep when your body physically repairs itself. During sleep, the body undergoes several psychological changes and repairs damaged tissues. Muscle repair and growth during sleep. The muscle releases a growth hormone, HGH. This hormone stimulates protein synthesis. During the process, muscle fibers are repaired and muscle tissues is built. Glycogen is also replenished, which provide energy for muscle contractions during exercise. Hormonal regulation. Sleep helps regulate hormone levels like testosterone, which promotes muscle growth and repair. Inflammation reduction during sleep. The body releases anti-inflammatory cytokinesis that aid in reducing inflammation. Muscle relaxation during sleep. The body enters a state of relaxation and the muscles can rest. Here are my sources.